hope everybody on the line and you and all your loved ones are staying healthy and safe during these unprecedented and uncertain times. Telehealth services have definitely been front and center in the news over the past 3 weeks, as many government officials have been urging citizens to utilize telehealth services. Telehealth services have been in the news at the federal government level and its health agencies, as they're encouraging all Americans to use telemedicine as the first line of defense for general medical care and for efficiently fighting the coronavirus. For those on the line who don't know the American Sustainable Business Council, I'd like to share that ASBC is a growing coalition of business organizations and companies advancing market solutions and policies to support a vibrant, just, and sustainable economy. Founded in 2009, ASBC and its association members represent more than 250,000 businesses across the United States. ASBC's issue agenda is to advance movement towards a sustainable economy, ensuring social and economic issues, as well as environmental benefits. ASB is partnered with Capstone Care Enhanced Telemedicine to offer a low-cost, efficient, next-generation telehealth plan for our members, a plan that is perfectly suited to the coronavirus we're all facing today, but will be equally beneficial for all healthcare concerns and any other future medical crises. With that, I would like to introduce Paul Tarnoff, National Marketing Director for Capstone Care, and Tom Selleck, his business partner, not Magnum PI, who's a corporate communications specialist in the health services and insurance field. So with that, I'd like to hand it over to Paul, and I will share the screen so Paul can maneuver his slides.
Great, thank you, AR. Appreciate the nice introduction.
Please.
Here we go. So it's a pleasure to speak with you about telemedicine. Unfortunately, it's been in the news for horrible reasons, but what I'd like to do is give you an overview of what telemedicine is and its value to both your business and employees, explain how it works, and then it will become very obvious of its timely value during the pandemic. So what I'm going to do is just run through an overview that's probably not what you expected. Essentially, I found out about telemedicine about 8 months ago. Now I've learned I'm probably one of the few people in America who never knew about it, and I was quite skeptical. And we did quite a due diligence. My company was asked to work with Capstone to really expand the number of customers it has. And what we discovered was, as a side, that there's this huge black hole of business expenses that everybody has linked to their employees. And now with the virus, it's even more obvious that something is needed. So what you're going to see is that telemedicine provides an affordable, innovative way to dramatically reduce these costs and the suffering that people have. I'm going to introduce you to someone that we call Sue, and I'll be referring to her throughout this presentation. She represents situations that every business faces every single day, throughout the day, multiple times. And I'm just going to give you 2 stories to start with. One was in the beginning, I was talking to a Pizza Hut manager who had an assistant, and let's say her name was Sue, his co-manager, assistant manager. And he had a baseball game with his son one afternoon and had organized the whole business. And she called up that morning and said she can't come to work because she's sick. And he just freaks out and he says, well, go to the doctor because your husband has insurance. And she said something that struck him. I can't go because of the huge deductible we have, and I don't get paid from you at Pizza Hut till next Wednesday. Well, that was one example. Another example was a business, just a marketing company that had 12 people in their office. And one day, this manager told me, one of them walked in and spread this horrible vibe through the room, and everybody was talking about it. It was because she had a fight with her spouse the night before. What do you do? That's what we're talking about, everyday experiences. And the reality is that everybody gets sick, whether it's illnesses, common illnesses, chronic conditions, emotional situations. All of us, not just our employees, suffer from them. And when we do, we're stuck with these hard choices. Do we go to the doctor? Do we stay at home? Do we go to work and get other people sick, and so on? And the third impact is on our businesses. We get hit by hassles and disruptions like Sue that lead to all kinds of operational situations and rescheduling worries. Well, the reality is that all of these things are known to us. They're systemic in our lives, in our businesses. But what we don't know is the bottom line P&L implications, because they don't appear on our financials, but they are widely documented. Going back to Sue, I'm going to give you some examples. Sue is the common employee, and our common employee can suffer from one or more of these conditions on any one day. And I'm not going to go through all of them, but these are very huge financial problems. And I'm just going to deal with the depression one, just to dig deeper. Most of us are unaware that more work is missed due to mental illness than any other chronic condition, such as arthritis, back pain, and heart disease. And it's estimated that 7% of all US workers experience depression. And clinical depression has become one of America's most costly illnesses. And left unattended, depression is now as costly as heart disease to the US economy, costing more than $35 billion in absenteeism. But it's not just the expenses of these things. As ASBC members and socially responsible business owners, we take serious that responsibility for our employees and their lives and well-being. And ASBC for years has advocated for sick leave, family leave, universal health coverage, and so on. But as standard insurance, self-insured policies, and wellness programs, which all help our employees, yet we still face this reality, that in 2018, over $880 billion was spent on health insurance, yet our businesses lost $500 billion in productivity just due to people being sick. We face a stark reality. In some cases, we can't afford to offer health benefits, but even with insurance, this happens. And it's interesting, because why does it happen? What can be done to improve upon this situation? I'm having a hard time. Oh, there we go. Well, it's not the doctor's fault. It's not the fault of those providing the medicine. It's the reality is that our employees cannot use the present structure of the health system. In fact, its use is discouraged. And here's examples that we all go through. All of us experience this, whether we have health insurance or not. And I'm just going to, again, focus on one of these, and that's the added cost. There's a person I know who has insurance from the place he works. He's a single father with a 5.5-year-old son. And he has a great insurance policy. And then his son got sick and he went to use it. And what he found was he had this deductible that cost him $250 for the doctor's visit. And he got quite angry in that he pays a premium every month and he couldn't even take advantage of the policy, and it cost him more to go to the doctor. And believe it or not, new fees are being added on. They're called facility fees, where now the corporations are taking over health facilities. The companies that own it are charging not only the doctors, but the patients to use the facility. And one of the fastest growing aspects of health insurance are prescription drugs. So what do? What happens as a result of this? What happens? People often choose not to go to the doctor. And whether the reality is of having insurance or not, it's all too often the situation that they don't go, and then they and our businesses suffer because of that. So what are we doing? Well, we try to change the healthcare industry. And look, even if they have insurance, 27% do not use it when they get sick. And as we try to change the system, we talk about single pay, Medicare for all, systems that blend different systems together. It's complex, expensive, And then we have to deal with the politics and the industries that lobby for these things. So again, what can we do that can help in this situation? And I'd like to introduce what may be a sort of silly analogy that I heard years ago from a very wise man. He gave the example that really reflects the healthcare industry. It's like a huge dark room, and you can't quite see clearly in it. No matter which way you go in a dark room, you move and you bump into something. You don't even know what it is, and you turn another way and you bump into another problem. But the reality is that if you could just turn on a light, introduce a second element, the light, all of a sudden you can see much more clearly. And you can see what's been hiding in plain sight. And that's what we realize telemedicine is like. Because if you put a light on the healthcare industry and all those reasons that people don't use it, what you find is an amazing fact that 80% of the time that they use doctor visits, they do not need to go in person. It's a remarkable fact that even Medicare has proven this, that yes, we want to talk to a doctor, that's what we need. 80% of the visits to doctors are for routine health conditions, illnesses, chronic conditions, emotional issues. And it's been proven that you do not need to be in front of a doctor to get the benefit of the doctor. And that is where telemedicine comes in. Telemedicine is the ideal, timely, low-cost solution for the employees and your business, because people don't have to waste the time and deal with all those issues we talked about before as to why they don't go to the doctor. Now they and their families can talk to a doctor anytime, anywhere. They don't have to miss work. They don't have to travel. They don't have to deal with waiting rooms at all. And even more timely right now is the fact that nobody wants to be in doctor's rooms because of the sickness that's in them. And recently, even though the industry is decades old, the government and health officials are recommending telemedicine as the risk-free solution for not only the virus, but for all general health conditions that I just mentioned. This is what it's like. So when you look at it, telemedicine successfully treats 80% of the common illnesses and chronic conditions that people have. And how it works is very simple. And again, each company is a little different. But what you do is whether the company offers it, you can call by phone, go online, or use an app to schedule a teleconsultation with an MD. Typically, depending which method you use, a care coordinator or the screen itself will ask you questions to review your symptoms. And then a doctor will consult with you. They're certified MDs that are licensed in the state that you reside in for treatment, and they may also prescribe medications if needed. Now, each company delivers this a little different, but that's the general methodology of how it works. Now, even before the virus, telemedicine has been the fastest growing health delivery channel in the country. And most of us didn't even know that it exists in this fashion. And this gives you an example compared to other places you can go to a doctor as to how fast that growth has been. And in the industry, almost all leaders expect telemedicine to transform our entire healthcare system in this decade. And 74% of the patients say that they would use telemedicine services. This is what telemedicine has been about. So it seems that telemedicine is the perfect delivery system, direct to the consumer, so you can talk to a doctor. But is it or not? What can go wrong? And this is a really important point to realize what the state of the industry is right now. Unfortunately, telemedicine comes with limitations that keep people from regularly using it. They love it. People who use it rave about it. Telemedicine has such a success rate. And the reason is people don't really want to go to the doctor, but they want to talk to the doctor. However, the industry has been like the computer industry was in the 1990s, where people who knew how to use computers and regularly use them loved it. But the user interface in the industry was not right. And as soon as that interface was fixed and made user-friendly, then all of a sudden, the growth was phenomenal. And the telemedicine industry is somewhat similar. Right now, the major telemedicine companies, and there's all kinds of companies out there, the major ones work with large insurance companies, and they become the provider of the service for those insurance companies. And in the vast majority of states, by law, telemedicine is required to be offered by insurance companies. So it's put into the policies that people have. But in general, it's not used regularly. And it's not the doctor's fault that this happens. And what I'm going to do is review for you the reasons that it's not used regularly by people. First is, most telemedicine companies, not all, are paid through a per session fee. So you pay as you use it. The national average for this is $40 per session. Now, during this time of the virus, obviously Medicare and other states are allowing people to have one-time use at no cost. The state or the government will pay for it. On top of this, what happens is many telemedicine companies limit the amount of time you can talk to the doctor, how long that call can be, or the interaction online. And if you want to have a longer interaction, you pay a little more. Another reason is that even though it's in policies, so if I'm a business and telemedicine is included in my healthcare plan, it's hidden in there. I can't tell you how often we speak to a business owner and they'll say, I think we have it, but I'm not sure. And if they don't know they have it, their employees don't know they have it. So there's not good communication targeted to everybody in the business ongoing to let them know the advantages. And therefore the employees and businesses are suffering. And then there's the communication technologies. As we all know, the cloud-based systems for communication like Zoom now and all these systems are changing rapidly. Early on, the telecommunications, the telemedicine companies have used things like conference calls, free conference calls and other online things like Join Me and Zoom, but they're not integrated into the telemedicine company. And therefore they're not consistent. And then there, in the past, has been inconsistent staffing. Like there's doctors who offer telemedicine part-time or to make some extra money. And therefore, the delivery is not always consistent. And lastly, what happens is one size fits all is the way it's been done. Here's how it is, and everybody adapts to it. Well, can these shortfalls be overcome with a truly friction-free, user-friendly system? Well, this is what ASBC has done. They're adding this solution to complement all of their other high road workplace health initiatives. And therefore, to address many of these shortfalls, they've partnered with Capstone Care for the services we offer, the pricing and delivery, and making it easy for businesses to take advantage of it. This is what Capstone Care offers. We call it enhanced telemedicine, not because the doctors are any better, but because of how it's delivered. First of all, there's no per session fees. People can talk to a doctor unlimited as many times as they want, and their families. There's no copays or deductibles on top of it. You have access to the doctor 24/7, just anytime you need it. And it's interesting, I was talking to some of the doctors a few weeks ago, and they were telling me that they'll have a patient who calls who thinks they have the virus. They'll go over their symptoms, and they're certain they don't have it. They'll tell them. And then 3 days later, they call back because now they have an imaginary sore throat or so on. Another feature that's offered through us is what we call message in MD. How often have you gone to the doctor and when you get home, you can't remember what the prescription was about or what they told you happened in your blood test? What do? It's impossible to call a doctor's office these days. Now, with our system, you can go onto the platform, send your blood test to the doctor and get back a message explaining your blood test or an x-ray or your prescription. And it addresses the high rising cost of prescription drugs with the prescription drug program. But even more, and the cost is only $14.95 a month per employee for unlimited use compared to $40 a session every time you use it. And for a family, it's only $5 or $19.95 a month for unlimited use. But even more important, as I previously mentioned, is the growth of mental health issues on individuals and the businesses. Research has shown that for every dollar invested in mental health promotion, it has a $3 to $5 return on investment. But what does that cost? Do companies even know how to do that? Do they have the money to do it? Well, mental health counseling is included in Capstone Care at no additional cost. Workers who receive, and I mean, this is a study that was done, that workers who received telehealth counseling for depression, this was done at Harvard, were more likely to keep their jobs, improve their productivity by 2.6 hours a week, and save companies $1,800 a year per employee. So we offer mental health counseling as well. And then on top of that, there's the element of proper execution. This is a new management tool going back to Sue. Imagine Sue coming into work, not calling in sick, but coming into work, and all of a sudden she has a headache or a cold or a cough. Or let's say comes in emotionally distraught over something. Well, what does a manager do now? Nothing. They're at loss. It's stressful for them. It's stressful for everyone. Well, by offering Capstone Care in your business, it's like putting a doctor right in the office. It's a new management tool. And we provide materials to help everybody know it's available, marketing tools so you don't have to do that. And we train your management in a few easy things they can do. So if the employee says they're sick, they can say, oh, go sit in the conference room, call the doctor, it won't cost you anything. That's a new capability in the workplace to address those financial issues. And therefore, through this high road workplace benefit, these various advantages are offered to a business for only $14.95 a month per employee. It's a wide-ranging offering of benefits. And most important of all, compared to other telemedicine programs, it's turnkey. It's fast and easy to implement. It's on autopilot. There's virtually no administration. You just provide us the names of the employees that will take part in it. We provide all the support. Compared to insurance policies, because this is not insurance, all it is access to a network of doctors. You don't have to do anything as compared to insurance programs, and it works side by side with any insurance program. We provide a lot of flexibility. First of all, you can tailor the program to your full, part-time, or contract employees. You can say that you want to pay for the full $14.95 a month or part of it or none of it. And basically, we would then give you materials to announce it to your employees so they can do it. And what's really nice is that there's no long-term commitment. You just pay monthly for the program. And we target, and not only do you pay monthly, but well, again, there's no long-term commitment. And then we have targeted communications that we provide so you can announce the program to your employees, your managers. And if you have, let's say you're a nonprofit, a membership club, or we're now working with credit unions who want to take it to their customers. It's just announce it to them as a benefit. We can work with any type of organization. We're working with a membership. We're getting ready to work with a membership club that offers all kinds of benefits to their members, but not this. And then we help you build awareness to encourage usage. So lastly, just think back, and it's hard, a few weeks ago before now we have this new reality around us. All of these benefits would have been valuable. Every single one of them would have been valuable. But we're in a new age now, in an age of uncertainty. The worst situation in life is uncertainty. Uncertainty of what's happening, of the marketplace, of my financial situation. Just think how much more valuable this could now be to offer to your company, your employees, maybe even your customers. We need to help. And it's like being at war. It's completely like being at war. And for a low cost, we can give comfort and give people an opportunity to deal with the physical aspects of the pandemic. But yesterday, a new poll came out that showed that 35% of respondents to the virus said that their mental health had worsened as a result of the pandemic. 43% said the same about their emotional well-being. And these numbers were significantly up from the week before. We need to give our people this. We need to enjoy these benefits. So we invite you to learn more about ASBC's High Road Workplace benefit of Capstone Care. So I'd like to stop and just, we'll take any questions you might have. AR, are you there?
Yeah, I'm here. I'm just want to make sure if people have questions. Hi, Harlan. Do you have a question? Okay, while people are maybe reflecting on Paul's comments, I actually had a couple questions, if I may. Can you hear me all right?
Yes.
Yeah, go ahead.
Oh, great. Can you tell us more about the mental health counseling benefits? It sounded like that was a big benefit, given that mental health issues are a significant portion of why people don't go to work, and kind of what limits they have.
Yeah, I can answer that. This is something that impressed me. My background is in affinity group marketing, and I've spent my whole life putting together basically fairly flimsy member benefit plans that a lot of organizations offer their members. And so I was really impressed by this one because it gives access 24 hours a day to master's level mental health counselors who are licensed or certified in your state. And you call up, and generally within 45 minutes or so, you're talking to a counselor. And you define your problem, you explain what's going on and all of that, and they will spend a half hour with you. It's a half-hour session, just like any therapist would. And then they will schedule another meeting with you if that's appropriate. And you'll meet again, say a week later or 5 days later, whatever seems needed, with the same counselor. So you basically get a therapist for free. And these are very highly qualified people. They deal with pretty much all of the things that you would go to a therapist for. I mean, smoking cessation, substance abuse, depression, anxiety, loss of a loved one, and anxiety about your finances, parenting issues, relationship issues, problems with your kids. And as Paul just explained, the stress level for pretty much everybody, especially in those areas which are pretty much going to be most of the country, where we're basically locked in at home with our families. Stress is going to mount, and people the nerves are getting frayed, and this is the time when people do need support. And so this is available on a regular basis. It's unlimited in the sense that I think there's limits in the sense you couldn't call every single day, but the therapists take their job very, very seriously and want to offer quality care. And they're very encouraging about this. In other words, one of the things that I've known about other types of benefit programs is that they're there, but then they're kind of hidden so that nobody uses it. And the provider that does this basically wants people to use the service. And that's just on the feeling level, that's a very important difference. So these are very, very, very open and welcoming therapists, as well as doctors, who are very happy to be helping you.
Great, thank you.
Can you hear me?
Is that Harlan?
Yes, this is Harlan Johnson. I'm a licensed marriage and family therapist in Rockford, Illinois.
Hallelujah.
And I was very interested in this. I've been providing services like this with Zoom for some time, and I do it as a private practitioner. I don't have to go through some other layer of something in order to do it, and that to me is a whole lot better. Doing this through Capstone Care, it sounds like we're talking about another bureaucratic layer that's going to cost money. The very problem people have, the very problem that the social democratic people have with insurance companies, the way they operate. we need to be able to have people operate individually. And at the same time, there is a structure within our local hospital system, which has what's called my chart. And although I'm not doing face-to-face, I communicate with my doctor all the time. And it's real easy, simple, and user-friendly. So anyway, I'd just like to have you comment after hearing all what I've had to say, any reaction to what I've commented about.
Well, Harlan, I mean, one question I could ask you, and I don't mean to pry, but I'm assuming that you charge a per session fee every time someone has a session with you. One of my friends is also a psychotherapist, and he does a very similar thing with Zoom or even just telephone calls.
Of course.
Yes, of course you do, but that's going to add up to be way more than $14.95 a month. So to those
Yes.
people who have the resources to have a private therapist whom they've met in person or even over the phone that they've developed a relationship with, that there's no question that's the ideal relationship. And you probably have very fortunate clients who value their connection with you, and that's in a sense the ideal model of a relationship between a health provider and a patient or a client. And for many people, that's out of their reach, especially part-time employees who just couldn't even think. There might be stress, but geez, they can't schedule the time. They certainly don't have $40, $50, $60, $70, $90 to pay for a session. And something like this could be of benefit to them. So this is not to substitute for the type of service you're offering, which I think is fabulous, because you're working one-on-one with people and you've developed great relationships with them. But for many people, that's quite honestly a luxury they can't afford. And so that's why this plan, makes something, it's several notches down, because they're never going to meet the person and, their therapist in person. Well, I'm assuming many of your clients have met you in person and have developed a personal relationship. So it's not really apples to apples. You're offering a very high level and, to put it bluntly, much more expensive service. And if you have the clientele that can pay for it, that's fabulous.
So how does Capstone make this work? How much do you pay the therapists you have, and how do you make it a winning proposition?
We are the front end of this. We're not even privy to how much they pay their doctors or the therapists. So I couldn't answer that question. Paul, maybe you have more knowledge than I do about that, but that's kind of a black box. That's something they do encourage professionals to sign up with them. I suppose you could go to their website and sort that out, but their business model works for them, and how they make it happen, I don't know, but I'm not arguing with the price.
They have many thousands of doctors now in their network that are their employees. They're not part-time people who work for them as needed. They have a waiting list of thousands of doctors waiting to join them. And these are doctors who, in general, they all have at least 15, the doctors have at least 15 years experience being a physician before they can join with Capstone Care. And they go through the training of how to use the systems. But having used the service myself a few weeks ago, I had a sinus infection 2 months ago that just lingered. And all of a sudden I thought, well, maybe I have the virus. So I called up, I made an appointment and called. It's so there's no bureaucracy to it. You just make up the appointment, and the doctor, as soon as they're freed up, will get back to you, or whatever time you want. Doctor gets in
and Paul, I just want to interrupt. Making an appointment means you call or you just use the app, and within 30 minutes to 45 minutes, the doctor calls you. So it's not like you're making an appointment for 4 weeks out or 3 weeks out, or the way you do traditionally with your own.
I was talking to the doctor, and he says, "What's wrong?" And I tell him, and he says, "Well, I bet you think you have the virus." And I cracked up laughing, and he laughed. He says, "You don't have the virus." And he gave me a home remedy to do, and my sinus thing went away in a few days. But I started talking to him, and turns out he's been a doctor. He's like 55 years old. He's been a doctor his whole professional life. And he did this because he got tired of the medical practice, the way it's done these days, the bureaucracy of it, the way you're not allowed to do certain treatments. So he enjoys, these doctors love doing this. and their joy comes through as you talk to them. So it's a, it's a certain segment of doctors who would rather practice this way. And then, as Thomas said, that there's lots of individuals who can't afford other services. And this is just so convenient. That's what it is.
Well, comparing this to my chart, which has my medical record all there,
right?
How does this organization manage to keep does they have a record of the history of medical treatments for the person who calls up, or is it just a one?
Oh, no, absolutely. They have, great medical records. They, the next doctor that talks to you has access to those records. It's all private. I mean, it's very highly regulated. That part of it is regulated.
HIPAA, yeah.
And
it's all HIPAA
compliant.
Yeah.
And it's really highly, it's been around. The profession's been around for 25, 30 years. It's just become much more sophisticated.
Thank you.
Yeah, you're welcome. Listen, good luck with your practice. You're doing a great thing to keep people afloat during these times, that's for sure.
Thank you, Harlan, for your question. Shelley, are you able to access the line? I know you sent in a question. If you want, you can ask it. If not, I'm happy to ask it on your behalf. Don't know if you're able to access the line. Okay, well, Shelley sent in a question. She's asking, is this available to sole proprietors, one employee only? How do we get more info?
I'll answer that, Thomas, because I sent AR. After this call, AR can, and anybody that wants to know how to learn more, just let AR know and he can send you an email. Yes, any individual can start, a company with one employee can start. The price is the same for everyone. That's what's great. If you're a large insurance company and you use telemedicine, you've negotiated a discounted price. It's pre-negotiated. The $14.95 is a great price. Imagine that for all of these benefits. So we are doing this with ASBC, so any business of any size can take advantage of it at that price. So you can sign up for your business, you can sign up as an individual, either one. So AR can send you the details of how to get in touch with us to take advantage of that.
Great, and I will definitely do so. And Tamara, I see you'd like more information too, so we will send you more information as well.
Can you still hear me?
Yes, sir.
How do I sign up as a provider?
I'll have to find out about that for you. I will find out from our provider how a doctor can inquire to become part of the network. I honestly we've never had that question before.
Yeah, Harlan, if you'll just provide your email, we'll make sure you get that information.
Yeah.
I'll put that in the webinar chat, which
Perfect. Okay,
I believe
good.
nobody noticed that I was sending messages with that before, but Zoom has this wonderful chat function.
No, we did. That's why we asked you to participate. So thank you for sending in the questions on the chat as well.
Okay.
Any other questions from the audience for Paul or Thomas? I know it's a lot to reflect on. Please go ahead.
Yeah, there's something I'd like to add. In this, my field, as I mentioned, I've been working with as a direct marketer in the whole insurance and affinity group area. And my specialty actually is the psychology of how and why members engage and how and why people take advantage or don't take advantage of benefits. And what Paul mentioned about this thing of people not using health benefits is there's the financial barrier that it might cost a copay or it might cost a procession fee. But there's also just the especially in the area of mental health, people are reluctant to even acknowledge that they have a mental health problem of any kind, whether it's depression, anxiety, stress, whatever. It's kind of, there's an onus on that. And this is structured in such a way that it's virtually friction-free, very seamless in order to access the service. So there's no, it's made as smooth and as streamlined as possible. And that overcomes a lot of these psychological barriers that we put up to reaching out for help. So the whole point, the whole way the app is set up, the whole way the system is set up is to essentially encourage people and make it as easy as possible for them to access the service. And one thing Paul and I are adding for the enterprise version of this, that is to say, if a company decides they want to engage, to sign up their employees, is that we are creating materials for the supervisors and the managers. If they notice someone is, all upset and freaked out and kind of their productivity is low, or they're just really not performing very well, there's very, very gentle ways to nudge them, say, hey, listen, we have this free service. You could just call one of the counselors right away, and you go in the meal room or in this empty office, and you already have the number. You already signed up. It's free. In other words, to encourage the use of the service. And I think that's a very important thing. We want to be proactive about encouraging our employees and our friends and our families using healthcare. It's underutilized, and that's why there's so much suffering. People don't go to the doctor or go to a therapist early enough. And anyhow, I just wanted to make that point.
This is Harlan with another question.
I'm sorry, Harlan, before you go ahead with your other question, Anthony had a question as well that I want to make sure he has the opportunity to ask, please. Anthony, are you able to access the line?
He can unmute himself. There's a little mute.
Yeah, he's on mute. Well, he sent it in as well, so I'll ask it. Are you there, Anthony?
No, he's still muted. I can see.
Okay. Anthony's question was, does this work with Medicare? What happens when a patient needs surgery? Who pays for the surgery?
That's a great question, and I may not have made it real clear before that there was so much information to cover. But this is complementary to any program you might have now. It's not a replacement for insurance. You don't get rid of your insurance when you have this. It's not an insurance plan. It's just access to be able to talk to a doctor. Now, Medicare offers telemedicine, and there's a per session fee to use it, except right now, in the time of the virus, if you want to talk to a doctor for the virus, there's no charge for it if you think you have symptoms. I also want to say that the telemedicine industry is much larger than this, significantly larger. It's used by doctors, as Harlan said, for all kinds of things, and we support all of it. I have a friend who had cancer, lung cancer, last summer, and he went up to the Mayo Clinic, had his surgery, came home. All the follow-up was done by the surgeons using telemedicine online. I heard a thing on the BBC radio that prenatal services during the virus are being offered by telemedicine. So it's used for specialty situations too. All that we do are these routine situations of illnesses, chronic situations in mental health that make up 80% of the reasons you talk to a doctor. If you have a need that's more critical than that, such as surgery, or you need to visit the doctor, you have a broken leg or whatever, then the telemedicine doctor is going to recommend you go see a specialist. And then you go do that using your normal insurance plan or Medicare to pay for it. So our program is really for routine situations. That in fact, I was talking to an insurance expert, one of the best at selling companies insurance. And he said, if you look at the use of insurance, it's an 80-20 rule. 80% of the reasons people go to visit a doctor are routine. 20% are for more critical medical issues. When you look at the claims being paid out, 80% of the dollars are spent on the major medical issues and 20% on those routine claims. So why should you have to pay more for that? And that's what we deal with. So I hope that answers your question.
Harlan, please go ahead. You had another question.
Yeah, what about link up with the local PCP, local primary care physician? You're part of that 80%, and you're talking to a doctor, you're getting help, but then you turn out to be part of the 20%. You need to be going in for a visit or something like that. is there a linkage between this system and the local system that I have in Rockford through my local health care system, which, as I say, it uses MyChart, which is an amazing way of communicating.
I use MyChart too. I live in Iowa and use MyChart in our state. There's no direct linkage. I will tell you that if there's any need to see a doctor, the telemedicine doctor, in person, the telemedicine doctor is not going to keep talking to you. They're going to refer you. Now, our provider, unlike many telemedicine companies, has quite a directory of specialists around the country. And on their platform and their app, you can see who they are, you can do a search and so on, but they do not have a direct relationship with anybody at the local level.
But so there are also specialists who you can talk to if you want to.
Well, they will refer you to specialists.
I mean, and telemedicine specialists?
Well, yeah, in other words, most doctors' offices and hospitals now have their own, as you said, have their own telemedicine capabilities for specialty situations. But that's not part of our network.
Okay,
so just to make it crystal clear, what Paul said, these 80% of routine means someone gets sick, you have a sore throat, you have an ear infection, you have a rash, you have diabetes, you have high blood pressure issues, you can have chronic illnesses. There's many, many, many things that are not what you would call minor, but they're routine. They happen all the time. That's 80% of the reason that anybody ever goes to a doctor. Those are the things, and those are the only things that this program deals with. So if you break your leg, if you get a cut, you have to go to the ER. There's no possible way we can deal with that. We're not set up to be an insurance company, and we disclaim
got that
very carefully. That's extremely important.
I've got that, but say I talked with the doctor. It's really clear. He's saying you've got a sinus infection. You need such and such a medication. I will issue a prescription to your local pharmacy, and you can have them do that.
Yep, exactly.
That's really, really great, because a lot of the stuff I do right now with MyChart with my doctors, I don't go in, but I end up getting a prescription sent, and then I'll go on to mail my prescription and get it for about a tenth the price I'd have to pay for with my through my Aetna insurance, which owns CVS. They charge 7 times as much for the medicine as I was able to get it through going to mail my prescriptions. It's just insane.
In our program, we have a similar low-cost prescription plan that you can take advantage of, rather than having it sent to your local pharmacy.
Oh, through this.
Through this program, that's right.
Yeah.
Oh, okay.
Yeah, there's actually 2 options. One is for, kind of routine discounts at local, like Walgreens, Walmart, CVS, those kind of discounts. But then there's also a mail order, which obviously takes a little bit longer. But if you're in a situation where you can wait to get the medication, that's an even steeper discount. So they've done everything they can to deal with the cost of the drugs, because those are really pretty sky high in a lot of cases.
Sounds great.
Yeah. No, I've joined it with my partner, Kathy, and we're both. I'm on Medicare, but I don't want to go in a waiting room. Okay, I don't want to go sit in the hospital waiting room. Thank you very much. Is it worth it to me to spend $20 a month for the family plan? To be able to talk to a doctor? Damn right it is.
Is this visual too? So you're seeing the doctor and they're seeing you?
Yeah. So that you have the Skype. I don't know if they use Skype or Zoom.
No, they have their own platform.
Yeah, they have their own platform. I've only done it, talking on the phone, just because it's not really necessary for me to do the video thing. But there's 3 different ways: with an app, with a phone, or on the computer. So 3 ways people can interface with the doctor, or with a therapist for that matter. Any other questions?
Harlan, since there's no questions right now, to answer your question a little further, one of our salespeople who works with us, he has a 5.5-year-old son who had a rash and was crying at 3:30 in the morning. And he's a single dad, and he was going crazy. I have to go.
Say hello.
make an appointment and, you know, do all of these other things, you know, and they have to wait to see the doctor and pay a deductible. So he used this. He used, you know, the program he's selling. And he got hold of the doctor at 3:30 in the morning. The doctor said, hold your son up to the screen. The doctor identified the rash and gave him the treatment, the advice right there.
My phone.
And that was it.
Someone's not on mute. We're hearing background.
So, AR, any other
questions? Shelley had one last question that you kind of answered right now. Her question is, do you have the option not to use video during doctor call? What do you do with the videos after? Are they stored, destroyed?
Good question. I know that you can just use the phone. You can just call.
Yeah.
And they operate under full HIPAA compliance. So again, I'm not an expert in HIPAA, but my understanding is that if there is a video of the call, it is destroyed because they'd be in serious violation of HIPAA regs if they kept it.
Wonderful. Any other questions for Paul or Thomas? Great. Well, it's almost 2 o'clock. With that, I'd like to thank Paul and Thomas and all of our participants for joining today. Please feel free to be in touch if you're interested in joining our collaborative effort to move these issues forward. For those who requested additional information, we definitely will be in touch. And on behalf of the American Sustainable Business Council and Capstone Care, we'd like to thank you again for your time today. And please continue to stay healthy and safe and take good care of yourselves during these unprecedented times.
Thanks, everybody. Great to meet you all. And as AR said, stay healthy.
Take care, everybody. Thank you.
All right. Thanks a lot.
Thanks a lot.
Yep,
Bye-bye.
bye.
Thank you.
Bye.